a violent event, being neglected, being in a war situation. Now, what actually makes an event traumatic? Sleep can be affected, anxiousness and constant worry, which affects many parts of their life. There is also evidence that trauma has an impact on the aging process. So how we're treated following the event itself is tremendously important. Now, people often ask me what the difference between chronic trauma and complex trauma is. In terms of what the long-term effects are of chronic or complex trauma, what seems to happen is that trauma leaves. A traumatic experience is one which overwhelms us. It's an event that leaves a wound. And we all have a window of tolerance in terms of what we can reasonably cope with. Beyond this, we become overwhelmed, and this is felt in our bodies, in our brain, and in our mind. Now, what actually makes an event traumatic? How an event affects us, and whether it is traumatic, depends on many things. Firstly, of course, the nature of the event itself, what happened. A violent event, being assaulted emotionally, physically, sexually, being neglected, being in a war situation for some people, a natural disaster or an accident. And whether that event turns out to be traumatic for the person involved also depends on where they are in life. How old are they, their age, the state of our health, how well that person is resourced, how well supported they are by those around them. So how we're treated following the event itself is tremendously important. In terms of what chronic trauma is, chronic trauma happens when there are repeated exposures to traumatic events, often over prolonged periods, weeks, months, or even years. Now, people often ask me what the difference between chronic trauma and complex trauma is. Complex trauma can be chronic in that it can happen over a long period of time, and it's where there is added complexity because the traumatic events happen within trusted relationships. The person may be subjected to trauma by people they should be able to trust, a parent, a caregiver, a sibling. And this is more complex as it often has a more profound effect. What I mean by that is it has a very, very deep effect on how people are able to go on living their lives. So how they can love and build relationships, and how able they are to work and live a full life. And the nature of complex trauma can lead to feelings of betrayal and shame and anger, and people can find it very difficult to trust again, or they don't know who they can trust, and sometimes they trust the wrong people. In terms of what the long-term effects are of chronic or complex trauma, so what seems to happen is that trauma leaves a wound, a lasting wound, and there is an effect in our minds, in our brains, and in our bodies, and these effects can live on in different ways. So traumatized people are often in states of hypervigilance. They're constantly on edge, tense, irritable, they startle easily. They constantly scan their environments, their actual physical environments, but also their relationships for signs of danger, for signs that the traumatic event may be happening again. And sometimes that can actually be in such an intense way that they relive the experience as though it's happening again. And that's when we talk about flashbacks, the actual reliving of the experience in a very raw, real way. And that's connected to something which we call dissociation. And dissociation is fairly common in trauma and can be on a spectrum of how severe it is. On the milder end, or in the milder forms, people can be slightly cut off. But in more severe cases, they can temporarily be almost entirely disconnected from what's happening in the here and now. And it can be as though they're back there where horrible things happened. And even when intense reliving settles temporarily, there's still a sense of anxiousness and constant worry. And people can feel jaded and without spark, and they can feel as though they're walking through treacle. Sleep can be affected, Many times trauma victims suffer disturbing dreams, often relating to the events, but not always. And there is usually an impact on mood, levels of energy, and how people enjoy life. Sometimes the impact can be such that a person's symptoms represent post-traumatic stress disorder. You may have heard of it as PTSD, or depression, chronic anxiety, or difficulties in terms of how their personality evolves and unfolds. And people can adapt to the initial trauma by usually doing one of two things, by becoming either much more rigid or becoming more chaotic, or sometimes even moving between rigidity and chaos. Now, what do I mean by rigidity? People try to adapt to make sure that the awful traumatic things don't happen again. And in the early days after a trauma, that might be very wise, so that they can avoid similar circumstances. They can avoid the circumstances that were surrounding the events. But over time, that might become excessively restrictive. They may limit how they live. They may increasingly avoid more and more situations which could trigger a reliving of the trauma. And they can be overly regimented when trying to control their life. Equally, life for traumatized people can feel very chaotic. So people with trauma can experience very, very intense, overwhelming emotions, not knowing who to trust. Sometimes people can become overly trusting or place themselves in vulnerable situations and unhealthy situations. People can struggle with dysregulated mood and irritability, impulsivity, which affects many parts of their life. And then there are the impacts on the body. We often think as body and mind and brains as separate, but actually they're interwoven and linked. Overwhelming experiences can be, of course, physical, but also even if they are not physical in and of themselves, if they're more psychological and emotional in nature, the events are still felt in the body, and our bodies respond. So at times of stress and trauma, cortisol levels, stress hormones, are elevated. That's the body's way of preparing us to respond and react in a situation. But if this persists over time, our immune systems and our cardiovascular systems can be affected. And more as time goes on, science tells us that there can be so-called epigenetic changes. That means that protracted trauma can have a negative impact on the expression of certain genes in our cells. And this can influence our body's responses to, for instance, infection, and can in and of itself cause chronic inflammation. There is also evidence that trauma has an impact on the aging process. So what we have discovered over time is that trauma affects stress and aging in our genes. Why do some people seem to recover from trauma while others develop long-lasting effects? This is a question I often get asked. So I think before we answer the question, it's always important in a conversation with the person posing the question to consider some of the feelings behind their query. So it can feel unfair, another blow. Sometimes, for instance, people tell me, it's as though having the initial experience wasn't awful enough. Why do I have to live with the effects of trauma when other people I see around me seemingly are not affected quite as badly? Other people I see can struggle with self-blame or be self-critical, feeling that it's an issue of resilience. Of course, this is really, really far from the truth, or they can feel hurt, thinking that those around them are questioning their resilience. The answer, in terms of the effect of trauma being different on different people, is never straightforward. But firstly, two people never quite experience trauma in an identical way. Even if on the face of things they're in the same circumstances and suffer similar traumatic experiences, there will be an individual nature in terms of how each person was affected. Then secondly, whether the traumatic experience causes a lasting wound or not will depend on aspects of that person's state of mind at that time. How old were they? How mature were they? What were their resources? How were they supported by those around them? For instance, we know that one of the most effective ways of preventing an overwhelming experience becoming traumatic in the long term is when the person affected has someone who can help them after the event. Is there a person in that person's life who sits alongside them, holds them, physically, metaphorically, helps them to make sense of what happened? And this is why, after large catastrophes, large disasters, coming together as a community can help prevent or ease chronic trauma. The last thing I want to say on that is that I think often we can assume that others are not affected if the effects of trauma on those people are quiet. They're sort of under the surface. Perhaps they're people who've become more controlled in their lives, more regimented. They become more steely, but they're not quite living to their full potential. In terms of the key stages of healing from trauma, the healing progress is gradual. It's also not linear. Things don't happen also on a sort of straight line. It can sometimes feel as though you might be taking one step forward and 2 steps back. But overall, the trajectory in healing is positive. And the first step in that is recognition and validation. So having an acknowledgement that something horrible happened and has left a lasting wound. And then there's a sequence of steps before a person can feel less stuck, where they can feel less fragmented and feel more equipped to live their life.
Harley Therapy, the UK's leading experts in therapy and mental health care, right here in London or online.
Now, moving forward, being adequately resourced is super important for healing. And I mean this in a very broad way. So, are your basic needs met? Are you now in a safe place where you can begin to recover? Or are you still in a place where your current circumstances are sustaining the trauma? It's very difficult to open up and be vulnerable to psychological interventions, to therapy, if your basic needs are not met, if you're still not safe. Maybe you need to focus on surviving ongoing difficult circumstances and moving to safety first. And maybe you need help from people around you for that aspect. And it's super important to have people around you who can help. Help you initially meet your basic needs, tend to you, and over time help you make sense of things, of the events that happened in a kind, non-judgmental way. And your resources are very important to consider before embarking on psychological interventions, on therapy. Now, before pursuing and embarking on therapy as such, it's important that you're well resourced. So, do you have good access to food? Are you able to sleep? Do you have access to regular exercise? Do you spend times outdoors in nature? Do you get to do things that you enjoy, that allow you to engage in activities that are meaningful for you? And do you have a sense of purpose through your interests, through your connections with people? Of course, all of these aspects can be affected by trauma. But if they're not already in place when you reach out for help, the first step that a psychiatrist or therapist may take may probably be to think with you about how you put these in place before doing some more challenging therapy work. Another question I get asked frequently, which is very relevant in trauma work, is the importance of healthy boundaries. Our boundaries are very much affected by trauma. As we adapt to what happened, we alter how we relate to other people. It may be close people, family and friends, it may be work colleagues, maybe acquaintances, authority figures, as well as how we relate to ourselves internally. Redressing that balance is very important, both in recovering and in staying well. Maybe you might hold people at bay when you're struggling. Perhaps you trust the wrong people. Now, healing requires you to map out these patterns, identify the patterns, understand them, and build up your connections in a different way. Now, in therapeutic work, we blend in routines and coping skills to help make the traumatic experiences, so the flashbacks, dissociation, hypervigilance, the anxiety, reliving horrible events. We work on coping skills to make those awful symptoms less impactful. So we focus on breathing exercises, grounding, mindfulness, yoga, helpful distractions, overcoming a reticence maybe to reach out to people. And then moving on to what the main body of treatment is to working with trauma, I'll say a few words about different models of therapy. So there are different models of therapy practiced by experienced clinicians in this field. And they practice what we call trauma-informed, evidence-based approaches, so rooted in scientific literature. And they include trauma-focused cognitive behavioral therapy, EMDR, somatic experiencing, psychodynamic approaches. And different models of therapy have their own distinct approach. But they do have commonalities, and what many experienced therapists will do is that they will blend models, bring them together in what we call an integrated way of working. Now, it's very important in therapy that the person who has experienced trauma feels safe, not feeling judged, and has a person sitting alongside them, a professional, who is working with them towards finding these new ways of coping. And it's very important that you feel it's a collaborative process, that things are not done to you, but done with you, and you're working together in working out what helps. And centrally, what's super important in a therapy work is the capacity to learn how to sometimes experience ruptures, and I'll explain what I mean by that, and repair. So rupture and repair. Ruptures, what we call in our jargon, maybe slight disagreements or having a different point of view, or sometimes feeling a little let down or a little frustrated, but being able to have a trusting relationship with a therapist whereby you're able to talk about that in a sort of open, honest, compassionate way and work through. And many people who have experienced trauma have significant difficulties with rupture and repair, but it's a very important part of being able to live life fully. In certain models, the emphasis is on reprocessing, so that the traumatic experiences lose their hold over you. In other models, there's a greater emphasis on identifying and working with patterns of thought, repeated patterns of thinking that come back again and again, which restrict your life, and they're linked with limiting behaviors. So you may avoid triggers in a way that regiments your life as you're trying to control it and makes your life not quite as rich and fun. Or we may be trying to manage behaviors that are more chaotic and lead to a more sort of chaotic lifestyle. In other models, there is an emphasis on talking and unfolding painful emotions. I spoke earlier about emotions of betrayal, shame, anger that you may have been sat with for a long time. And learning to identify those as they come up, make sense of them, learn how to sit with them and process them in a different way so that you can move on. So trying to make sense of things, as I say, and building up a new narrative. Now, commonality across all models is that trauma, one of the things that trauma seems to do is it seems to hold you in the past. What do I mean by this? Following trauma, it's very common for us to continue to live as though we're still under threat, as though we're still in that old, horrible situation. So being constantly on edge, vigilant, flashbacks, how we are with other people, can be ways of managing threats when the threat may have actually subsided. And in a therapy, we're trying to bring you back to the current moment so that you can live life as it is really right now. We haven't spoken about medication yet. Psychiatrists or your family doctor, your GP, often prescribe medication where trauma has caused post-traumatic stress disorder, depression, or anxiety. Sometimes specialists will prescribe for what we call symptomatic management, so to help with issues such as severe impulsivity, very intense emotions, or self-injury. This is more complicated and requires assessment in depth and a detailed conversation with your clinician. And this is in keeping with what you should expect from your clinician, whether it's a psychiatrist, a therapist, or your GP. There should be a collaborative, trauma-informed conversation. That means that it's without judgment and it's supportive and encourages you to meet your challenges and move forward. So working together so that you can help identify what is currently the matter, how trauma lives on, and what might help. It's also important to identify what could make things worse. i.e., are you in the right place to start challenging therapy work right now? Or do you first need to work on some building blocks, on your basic needs? What is the balance in your specific case in terms of prescribing medicine? Now, how can someone build resilience after chronic trauma? Now, we often think of resilience as bouncing back or as just letting events bounce off us. Now, resilience is more, there's more to it than that. It's about accepting what has happened, understanding and healing. And this is what brings us back to the here and now. So it's important to take care of ourselves, build healthy relationships, form good boundaries, and through that we can become more adaptive, more flexible. We can re-find our spark in life. We can find people and things in life that we connect to, that we care about, and this gives a sense of purpose. So all those elements contribute to resilience. I'm slightly always cautious when I get asked questions about resilience because, as I mentioned a little earlier, people with trauma can sometimes feel that somehow they may have failed in some way, or they may consider that people around them consider that they've failed in some way in terms of not being resilient enough. So it's a nuanced conversation. Resilience is important, but it's important to consider what that actually means for you. When to seek help? I'd say straight away. There are always treatment options, but the longer unresolved trauma is left untreated, the more difficult it can be to recover. Seeking help can be in various ways. There are many steps. A step where you are right now might be resourcing yourself, adjusting your lifestyle, extracting yourself from a dangerous situation, an unhealthy relationship. It might be about starting to live more healthily, before then considering therapy and medication. Sometimes you can do steps at the same time, bringing everything together. Sometimes it has to be sequential, but reach out and talk to the right people. In terms of what message I would give to someone who's feeling stuck right now or overwhelmed, I think what I'd finally say is you're not alone. If you're watching this video, you're either most likely suffering with the effects of chronic trauma or have a person who you feel close to who is suffering with trauma. And by watching this video, you're trying to learn and understand. If you're not yet in a safe place, in a safe relationship, that could be the next step, moving to safety. Be kind on yourself. If not already, think about living healthily. Basic but very important aspects of life in terms of how you eat, how you sleep, how you exercise, making space for good routines, how you connect with the people in your life. These are crucial first steps. Some people benefit from joining support groups. It can be very powerful to know that others are living with, navigating through trauma and sharing experiences. Knowing that you're not alone in terms of there are other people out there who know how it feels. I say that with the acknowledgement that you may not be ready for that, and groups of people may feel overwhelming. Just being with other people in large groups or even small groups can feel scary, even if those people are kind and well-meaning. And then in terms of treatment, there are people, professionals to work alongside you with approaches rooted in science that can help and do help many people.
Subscribe for more insights from the experts at Harley Therapy, and don't miss our next video.